Hello, and thank you for your interest in the Administrative Fellowship at UTMB Health. This presentation will provide information regarding the UTMB Health System and the Administrative Fellowship Program. My name is Kristen Young, and I serve as the current Administrative Fellow for the UTMB Health System. I completed my Master's in Health Administration at Cornell University. During graduate school, I served as a program coordinator for the ACHE Southeast Texas chapter, where I was involved in facilitating and spearheading various strategic initiatives for the chapter. I interned at Vanderbilt University Medical Center, where I supervised a specialty-wide quarterly quality improvement initiative and was involved in various process improvement projects, which impacted a significant portion of patients in obtaining timely needed care.
My name is Stephanie Kubachka, and I was the Administrative Fellow from 2022 to 2023. After completion of my fellowship, I transitioned into my current role as a Laboratory Services Manager in Laboratory Services Administration. I completed my Master of Healthcare Administration and Master of Business Administration at the University of Houston Clear Lake.
During this presentation, we will bring you with us to learn more about the Galveston and Greater Houston area, and then discuss UTMB's mission and values, notable achievements, organizational history, and complex structure. We will also cover the administrative fellowship structure, preceptor, various types of projects that the fellow has the opportunity to be involved in, and the application process. UTMB has had over 40 successful fellows, and some of the executives and directors are former fellows from various institutions. Additionally, the institution's employees reflect the diverse population it serves. As one of the top 20 nationally ranked Vizient academic medical centers, UTMB is in a time of system-wide growth, allowing the fellow an opportunity to work on a variety of projects. Fellows will have continuous exposure to the executive team and the opportunity to network with other Texas Medical Center fellows. Texas is home to UTMB's Academic Medical Center. This is where our main campus and administrative hub is housed. There are two major industries in Galveston: tourism, as the island is rich with history and culture, and healthcare. The summers are the busiest times for both. Patient volumes typically peak from June to August. UTMB is located only 50 minutes outside of Houston, so employees can experience both island and city life. Galveston is also home to 32 miles of beaches and numerous events and festivals, such as the largest Mardi Gras celebration in Texas. UTMB also serves the greater Houston area, south of the Loop, known as the Bay Area. Clear Lake and League City are located only 30 minutes outside of downtown Houston, where residents have easy access to enjoy what the city life has to offer. Houston is home to not only the largest medical city in the world, but also diverse cultures alongside a wide variety of shopping, entertainment, and dining options. With no shortage of activities and a low cost of living compared to other populous cities, the Houston area is a great place to live. The mission of UTMB is to improve health for the people of Texas and around the world. This is done by offering innovative education and training, pursuing cutting-edge research, and providing the highest quality patient care. UTMB's vision is to work together to work wonders while living out the values of compassion, integrity, respect, diversity, and lifelong learning. Speaking about lifelong learning, UTMB strives to continuously improve and think forward. This is evident through the health system's multitude of awards and achievements. UTMB Health is nationally ranked number 14 out of 115 Vizient-rated AMCs and has won 3 consecutive national awards for 5-star performance through providing superior patient care in our hospitals. UTMB was also one of the institutions nationally recognized for the organization's innovative efforts during COVID-19.
UTMB is comprised of 5 schools and home to the nation's first public medical school, which is one of the largest in Texas. The institution currently serves over 3,000 students and has increased enrollment to meet the nation's healthcare needs. UTMB receives approximately $144 million in grants and contracts for research purposes. The UTMB campus includes the Galveston National Lab, which, as seen in a previous slide, is one of 2 biosafety level 4 labs in the U.S. The Galveston National Lab is working on developing vaccines for many of the world's infectious diseases, including the Zika and Ebola viruses. Of course, the Galveston National Lab conducted research and development related to COVID-19 and continues to do so. In fact, it was the first reference laboratory in the world to distribute the first virus isolate and to distribute RNA for diagnostic development and test validation. UTMB Health is a large and growing health system of comprehensive services. UTMB Health is designated as the only Level 1 trauma center in Galveston County and one of 4 in the Texas Medical Center. We advance patient care by using technology, research, and innovative care models to improve healthcare outcomes for the population we serve. UTMB has an extensive telemedicine program used for research and patient care. This allows us to provide care to patients at correctional facilities throughout Texas, on cruise ships, in Antarctica, and at community clinics for the underserved. As the Region 2 anchor for the Medicaid 1115 waiver, we help support the establishment of regional healthcare partnerships to improve the ability of other health organizations to meet community needs. This map illustrates the expansiveness of UTMB throughout Texas. In addition to the care we provide in the Bay Area, we also have correctional managed care and regional women's and pediatrics clinics throughout the state. After Hurricane Ike in 2008, UTMB began growth strategies for delivering care to the mainland. This map illustrates the hospitals and clinics that have opened as of March 2019. UTMB has 4 campuses, the Academic Medical Center in Galveston, and 3 regional hospitals in the Bay Area. Those 4 campuses make up 6 hospitals, and there are 108 outpatient clinics across Galveston, the Bay Area, and Brazoria County. One of UTMB's many unique attributes is that we are home to Hospital Galveston, the only hospital in the nation that is focused solely on offender care. Our economies of scale combined with advanced telemedicine allows us to provide an extremely efficient model of care, resulting in the annual spend per offender to be 30% below the national median, making us the most cost-effective in the nation.
The Angleton Danbury campus provides a variety of quality services, such as an ACR-accredited mammography program, cardiopulmonary clinical laboratory, diagnostic imaging services, outpatient surgery, rehabilitation, physical therapy, and a 24-hour emergency services. Renovations to the emergency department are currently underway. UTMB's League City campus, completed with inpatient and outpatient care, medical and surgical specialties, expanded hours urgent care, and a 24-hour emergency department, is located about 30 minutes north of Galveston in a growing community and is in partnership with MD Anderson for oncological care. To serve the growing demand of the market, the League City campus completed an interior renovation in addition to an expansion in March 2020 that features 2 ancillary floors and increases the hospital's capacity to treat up to 97 inpatients. The expansion also added a 750-stall parking garage, a medical plaza building, and a conditioned skybridge to connect the garage to the hospital. Plans are already in the work to continue expanding. In March 2019, UTMB Health began operations at our Clear Lake campus, allowing us to further expand our reach to the mainland. This facility offers a comprehensive range of services such as endocrinology, labor and delivery, orthopedics, cardiovascular care, neurosciences care, and more. UTMB is finalizing a plan to build a helistop and continues to expand services at this campus in order to be designated as a Level 2 trauma center. There will be opportunities for the fellow to get involved in projects and rotations at our regional hospitals, such as this campus. UTMB opened the new Jenny Seeley Hospital and Clinical Services Wing in 2016. The hospital features 310 patient rooms, including 60 highly advanced ICU beds and 20 state-of-the-art operating suites. The construction of this hospital has provided the necessary clinical capacity needed for the Phase 3 modernization of John Seeley Hospital. The original John Seeley Hospital opened in January of 1890 and became affiliated with UTMB 1 year later. The current John Seeley Hospital building was built in 1978 and now serves as a hub of inpatient care for women's and children's services. A major renovation is underway, which includes significant interior redesign as well as replacement of the building's facade and covered driveway. As the expected completion of the project in 2022, women and children's inpatient care will be fully consolidated from adjacent buildings into the John Seeley Hospital with expanded capacity for pediatric patients and mothers and babies. As previously mentioned, Galveston's main campus has been home to the Texas Department of Criminal Justice Hospital Galveston since 1983. This is an acute care facility that provides inpatient and outpatient services for Texas inmates within the confines of a secured environment, staffed by TDCJ officers. Hospital Galveston has a whole floor dedicated to ambulatory clinics, as well as 138 patient beds and 57 infirmary beds. The fellowship at UTMB is a year-long program, which will begin in the summer of 2024. Our fellowship program uniquely caters to the interest of the fellow. The administrative fellow participates in the day-to-day health system operations and works closely with an accomplished senior leadership team on a wide array of projects and initiatives. Fellows have significant exposure to the executive team and are expected to attend and participate in weekly executive meetings, health system executive leadership retreats, and project work with executives and next-level leaders. Additionally, the Fellow's office is located in the administrative suite of Jenny Seeley Hospital, which provides daily access to the executive team. Mentorship and building relationships with UTMB enterprise leaders are strong components of our program. The fellow will have various opportunities to work with the executive team and participate in professional development activities, such as the Developing Lean Leaders Book Club with UTMB Health System CEO Dr. Harlan. Within the C-suite office and all across UTMB Health, the fellow will be able to experience a truly authentic, genuine, friendly culture. You will no doubt be warmly welcomed the moment you arrive at UTMB, and also amazed by everyone's passion to continuously improve the organization to provide the best care possible to our patients. To foster further development of the fellow, UTMB allows for travel to one conference over the course of the fellowship. The preceptor for the UTMB Administrative Fellowship is Beth Vengado, who is the VP of Health System Optimization and Performance. Beth works vertically throughout the system to ensure that locations, services, and other patient interactions are aligned and seamlessly coordinated. She provides a wealth of expertise related to outcome reliability, process improvement, change management, and the use of management systems. Beth is a results-focused, highly qualified change catalyst and lean sensei with more than 20 years of experience that complements UTMB's best care and high-value practicing organization efforts. Prior to arriving at UTMB, Beth led the strategic support services and lean systems at Denver Health for 7 years. As the fellowship preceptor, Beth engages with and supports the fellow as she helps them navigate through their experience. This slide gives an overview of some of the initiatives I have begun and some opportunities I've had within the first month of my fellowship. My goals for this year include gaining a comprehensive view and understanding of UTMB's complex system and structure, being involved in and managing various diverse projects that will provide me with new knowledge and skills, getting to further meet our patients and aid the communities we serve, and building meaningful relationships that will support me in my healthcare journey. It has been a pleasure learning about and being exposed to various high-level initiatives and how decisions are being made by senior leadership. I'm also excited to learn about system strategy, ambulatory operations, process improvement, community and population health initiatives, business development, and so much more.
This slide shows a few of the many projects and activities I was involved in throughout my fellowship. I facilitated the Health System Executive Leadership Team at the annual retreat. I helped in the incoming Administrative Fellow recruitment. I developed Access Steering Committee scorecard and participated in access improvement projects and meetings. I was also involved in the planning, coordination, and data management of the hospitalist service line. I led efforts around optimization of the anatomic pathology workflow to decrease turnaround times. I managed contracts with external vendors in laboratory services. I directed process improvement projects in the ambulatory space to reduce clinical lab order errors. I also oversaw the planning and operations of UTMB's new groundbreaking neutralization lab. I also participated in the development and design of an innovative cancer screening application for the Department of Pathology.
To apply for the fellowship, a completed application packet must be submitted by September 4, 2023 at 5 p.m. Central Time to Human Resources. The packet should include the application checklist, which can be found on the UTMB Administrative Fellowship website, a cover letter, resume, personal statement, graduate transcript, and 3 letters of recommendation in one PDF. This file should be attached to your application. We will review that application and conduct phone interviews early September and subsequently have on-site interviews mid-September. For more information, please visit www.utmb.edu/administrative fellowship. This concludes our presentation. If you have any questions, please contact me at the email or number listed on the slideshow. Thank you for your interest in the Administrative Fellowship at UTMB. We look forward to receiving your application.